Good afternoon and welcome, everyone. I'm Jen Monroe-Zakaris, Associate Director with the University of California Center for Climate Health and Equity, and I'm pleased to kick off our webinar today, which is the last in our four-part series on evidence and innovations to confront the climate health crisis. When we say that climate change is a health crisis, we mean that it is creating unprecedented risks to human health and well-being, harming our physical and mental health, causing injuries and deaths, and disrupting our economic and social systems. We're facing a century in which climate change will be the world's leading threat to health equity. And yet this also means we are facing historic opportunity to redefine the conditions of our lives in ways that promote healthy and equitable communities for generations to come. We at the UC Center for Climate Health and Equity therefore believe that health and health equity must be at the center of action to confront our climate emergency. Our mission is to harness the expertise and leadership of the health sector to drive ambitious climate action that promotes health equity and health action that reduces climate change impacts. The center is based at the University of California, San Francisco, and spans all 10 UC campuses and 5 health systems with over 100 affiliated faculty. We advance our mission through the 4 strategic work streams of research, education, health system sustainability, and policy, as well as through special initiatives like our new Climate Change and Mental Health Council. I'd like to thank both the UCSF Office of Sustainability as well as the UCSF Academic Senate Committee on Sustainability for their support and contributions for this webinar series. Today, we'll be focusing on the climate and health impacts of our food systems. It's my pleasure to now introduce today's moderator, the Managing Director of our center, Sapna Thodato. Prior to joining the center, Dr. Thodato was an Associate Director of Sustainability in the University of California's Office of the President, and her portfolio included supporting sustainable food service, water conservation, and minimizing pesticide use. She's worked on environmental policy for multiple organizations, from the U.S. Environmental Protection Agency to Healthcare Without Harm, and has published books on sustainable food and farming, including India's Organic Farming Revolution, What It Means for Our Global Health System, and Institutions as Conscious Food Consumers, Leveraging Purchasing Power to Drive Systems Change. She has also served on and advised many boards and organizations, including the Pesticide Action Network, Plant-Based Foods Association, and the California Department of Food and Agriculture. She received her PhD from UC Berkeley in geography and her Master's of Science from Oxford University in Environmental Change and Management. Sapna, I'll let you take it from here.
Thank you so much, Jen, for that introduction. And thank you to everyone in attendance for joining this rescheduled webinar from the spring. For our last session in this 4-part series, we thought it would be important for us to focus on our food and farming system. And I'm pleased to announce our 2 speakers who are experts on this topic, 2 individuals I've known for a long time and who have shared connections in the UC system. Our first speaker is Dr. Kendra Klein. Dr. Klein is Deputy Director of Science at Friends of the Earth. She leads research on pesticides, environmental health, and sustainable agriculture. Prior to joining Friends of the Earth, she held positions at Physicians for Social Responsibility, Healthcare Without Harm, and Breast Cancer Action. She is a Switzer Environmental Fellow, and her work has been published by The Guardian, The Nation, Gastronomica, and more. She holds a BA from Miami University of Ohio and a PhD in Environmental Science, Policy, and Management from UC Berkeley. Kendra and I overlapped at Healthcare Without Harm in UC Berkeley and co-wrote many articles on sustainable food procurement by institutions. It's good to see you today, Kendra. Our second speaker, Dr. David A. Cleveland, is a food system ecologist who has done research and project work on sustainable agri-food systems with small-scale farmers and gardeners around the world. Dr. Cleveland earned an MS in genetics and a PhD in agricultural anthropology from the University of Arizona and is a research professor in the Environmental Studies program in the Department of Geography at UC Santa Barbara. His current focus is how we can work together to make our food systems support human and environmental health and social equity. This includes the potential for diet change to improve nutrition, reduce greenhouse gas emissions and environmental damage, and promote food and climate justice in California, the US, and globally. I also had the opportunity to work with David while I was in UC's Office of the President on healthy beverages and thinking about the climate footprint of food in our university system. And it's good to see you again, David. Before I turn over to Kendra, who is going to be speaking first, I wanted to let everyone in the audience know that we will have a few minutes for Q&A at the end. Please submit your questions in the Q&A feature of the Zoom chat, and I'll share them with the speakers later on. Kendra, I'll let you take it from here.
Great. Thank you so much. Very happy to be here and to have the chance to talk to all of you today. I am going to dive into the intersections of pesticide use, climate, and health. And oops, I'm going to start here, just asking all of you to think about what you've eaten so far today and consider the fact that we really are the environment that we eat. We are made of the iron from leafy greens, the vitamin C from carrots, and the embodied solar energy of that food is what is fueling your body and allowing you to sit here and listen to me. But as eaters of the modern industrial food system, we are also made of a host of different pesticides. If I tested any of your bodies today, I would find pesticides. Pesticides really elegantly, if destructively, highlight the interconnectedness of the web of life. Those same pesticides that I would find in your body and that are linked to health harms are decimating pollinator and other beneficial insect populations, harming soil health, and contaminating aquatic ecosystems. I am going to start us off here thinking about pesticides and human health. This is a landmark study that has since been replicated many times that looked at the industrial pollutants, including pesticides, found in umbilical cord blood, and really showed us that we are being born pre-polluted. We are exposed to a host of different pesticides. This is USDA data looking at what residues are found on apples. And you can see they are linked to a range of different serious health problems. And for the general public, diet really is the primary route of exposure. We know that our children face the highest risks. This is from a paper co-authored by the former head of NIEHS, Linda Birnbaum. That's because their bodies, and I will add infants and babies in utero and adolescents, their bodies are going through such rapid stages of development that even small exposures can have significant and lifetime impacts. And children are also eating more per body weight and therefore are more highly exposed. From the same paper, we know that our regulations have not kept pace with the latest science. One of the reasons is the growing body of data on endocrine disruption, showing that chemicals, including over 50 different commonly used pesticides, can act like hormones in our body. They can block or mimic or scramble our own hormone messages, leading to a range of health impacts, from obesity to risk of certain cancers, to infertility and reproductive problems. And our current regulations that set levels of exposure, acceptable levels of exposure for the US population, don't take this into account. Nor do they take into account the cumulative exposures. Safe, quote unquote, safe levels of exposure are set chemical by chemical. But we are exposed to a cocktail of different industrial compounds, including pesticides. And what I've pulled out here are the OPs, the organophosphate pesticides, highly neurotoxic. They're associated with increased risk of behavioral and attention problems, lower IQ, and neurodegenerative problems. And this could be an average rate of exposure, which is on par with what doctors prescribe for drugs like Ritalin. So compounds that we know affect our brain chemistry. We are being exposed to neurotoxic pesticides and other compounds at similar levels. So those small exposures do matter, and cumulative exposures add up. We know that farm workers are on the front lines of exposure, and they suffer far greater health impacts as a result. This is not an exhaustive list. You can see some of those health problems. And we know global pesticide use is increasing. Unfortunately, we are heading in the wrong direction. Similarly, in the US, pesticide use is increasing. And the US is really a laggard when it comes to acting on the science. The EPA is still allowing the use of 85 different pesticides that have been banned or being phased out in the EU, China, or Brazil. So we know that those regulations are just so out of step with the science on health harms and environmental harms. So I want to take us back and look at the intersections with soil health. And why soil? Because if you like to eat, thank the soil. It is the source of 95% of the food that we eat. So it is fundamentally bound up with our own well-being. And it is also part of growing conversation about climate change. One, because it's the interface of farmers' resilience or vulnerability to climate-related weather events like droughts and floods. And there's also a growing conversation about the possibility for soil to serve as a carbon sink, to draw carbon out of the atmosphere and hold it in the soil where it goes from being a problem to a real solution. We know that increasing soil organic matter is associated with a range of benefits. That is a huge conversation with a lot of debates we could have about the data. So I'll just leave it there. We know that some soils sequester more carbon than others. And so, what we need to understand about that, about the possibility of the soil to help mitigate or adapt to climate change, is that it is the livingness of the soil that allows that to happen. Healthy soil is living soil. The invertebrates and the microorganisms in the soil are what provide this whole host of different ecosystem services. And soil is the most biodiverse ecosystem on the planet, and we are just beginning to understand the complexity of it. So it's no surprise that chemicals that are designed to kill harm soil ecosystems. These are two meta reviews. The top is looking at invertebrates. The bottom is looking at microorganisms. The top one I co-authored for Friends of the Earth, we found that pesticides kill or harm soil invertebrates in 71% of cases studied. And the bottom one, of many forms of mortality and morbidity, I pulled out this one, finding that pesticides damage the microbial bridge that is necessary for carbon sequestration, because that is such a driver of our conversation around soil and climate. Here's a graph from that first study on invertebrates. And what you're seeing is that this is across classes and types of pesticides. And pesticide is an umbrella term. It incorporates insecticides, herbicides, and fungicides. And then you can see across the classes, neonicotinoids, organophosphates, glyphosates, that we're seeing a greater than 50% negative impact for all but one of those classes. And so the take-home message here is that pesticide use is fundamentally at odds with soil health. We are using pesticides year after year in multiple use per season, and some of them are very persistent in the environment. So soil ecosystems have very little time to recover. As one example, the USDA estimates that Washington apples are treated up to 17 times in a year with 51 different pesticides. So this really is a chemical onslaught. We need to understand that conversation around soil and climate change, that possibility that we can sequester carbon, which is happening under the banner of the term regenerative agriculture, needs to incorporate pesticide reduction, because too often that is left out of the conversation. We are finding that some of the largest pesticide companies have become the loudest voices in this conversation. And so when we're setting policies, when companies are developing regenerative ag goals, that needs to incorporate reduction of pesticide use. Farmers are also not winning in this system. In this survey on the top, 90% of Iowa farmers report feeling that pest management is a never-ending technology treadmill. And that's because nature evolves. Weeds and insects develop resistance to a ubiquitous use of pesticides. And so farmers turn towards more toxic chemicals or towards repeated uses of chemicals in order to deal with these resistant pests. We can see this happening in action because of the use of Roundup across the Midwest Corn Belt. We are now seeing increases in use of 2,4-D and dicamba. antiquated hazardous pesticides. 2,4-D was one of the components of the Vietnam War defoliant Agent Orange. If you're interested in how that impacts our health, I'd direct you towards the Heartland Health Research Alliance, which is conducting a very large cohort study of pregnant women and following the moms and babies and looking at their herbicide exposure. What you're looking at, I want to make the connection here. Why this constant use of Roundup? Why is it driving resistant weeds? And you are seeing a graph of the acreage planted in genetically engineered crops in the US. And 98.2% of that acreage is engineered to be herbicide tolerant, to be Roundup ready, and now stacked to be tolerant to Roundup and 2,4-D and dicamba. Some of that is also insect resistant, and you can see some is only insect resistant, and then any other type of application of genetic engineering in crops is far less than 1%. So really, currently in the US and around the world, GM crops equals herbicide tolerance, and therefore is driving this increased use of pesticides. So I want to give you some fun statistics. I grew up in Wisconsin. This is what the landscape looks like there. 95% of the soy, 92% of the corn is Roundup ready. These are the crops that are largely driving that use. And to make a connection to animal agriculture, which you're going to hear more about next, 36% of that corn goes to livestock feed, 40% goes to biofuels. So these landscapes, these very pesticide intensive landscapes are really not growing food primarily, not quote unquote feeding the world, right? And, you know, we need to also understand that the same commodities are grown with neonicotinoid coated seeds. And just to pull in for one slide here, the bees, because I do a lot of work on pollinator health, you're seeing the inflection point in 2004 when we began coating corn and soy seeds with neonics. And this is when we've really seen an increase in the toxicity of US agriculture for pollinators and other insects. So when you see headlines about the insect apocalypse and insect declines, neonics are really critical driver of those declines. And just to point out, this use of neonic-coated seeds is prophylactic. A lot of data is showing that it's not even beneficial for farmers. So if you want to take up a cause, getting rid of neonic coatings on seeds would be a great one for the environment and for human health. They're increasingly associated with human health harms. We expect that climate change is going to amplify this treadmill, this vicious cycle, in the words of Pesticide Action Network, which recently published this very excellent report making these connections. And that's because changing temperatures are going to change the ranges of certain pests, increase pest pressure, and perhaps decrease the efficacy of pesticides, and decrease crop resilience, the natural immunity that crops can have to resist pest and disease pressures, which will in turn increase pesticide use. So we really are in need of figuring out ways to get off this treadmill. The great news is we do have solutions. We have decades of data, in fact, showing that ecological farming methods can manage pests with few or even no hazardous pesticides. So here's just a list of some of those types of practices. And really, this is a paradigm shift from competing with nature, a sort of chemical warfare with pests, to partnering with, learning systemically about those ecological principles and trying to employ them to our benefit. From doing something that nature does not do, monocultures, towards building diversity into the system. Organic farming is the leading certified form of ecological farming and really is the gold standard for pesticide reduction. Over 900 different synthetic pesticides are allowed for use in conventional agriculture, only 25 least toxic synthetic pesticides are allowed in organic agriculture. And these systems function because of those ecological methods that provide fertility and that manage pests. We know that organic works in terms of reducing our exposure to pesticides. This is another study I co-authored for Friends of the Earth, along with researchers from UC Berkeley. And what you're seeing is that of the pesticides that we tested for, we found in people's bodies. And after just 1 week on an organic diet, the levels that we found dropped dramatically. This has been replicated by a dozen other studies showing organic can rapidly reduce our exposure. And we also know, pulling just some studies here, that organic diets can reduce our risk of a range of different health problems: infertility, birth defects, allergies, certain cancers. What this points to, this doesn't exactly say, but what it points to is that, yes, those dietary exposures matter, because when we decrease those dietary exposures through eating organic diets, we see a range of health benefits. We know organic production can also help mitigate and adapt to climate change. I'm just pulling a few citations here, but there are many more, showing organic soils can sequester more carbon and sequester it more deeply and persistently, which is, of course, what we want. And it can increase farmers' resilience to droughts and floods. And finally, to bring back the bees, we know that organic farming systems can help protect biodiversity above and below ground, increasing species richness, diversity, and helping those beneficial insects that we need flourish. So often this conversation focuses on yield, and that is really a myopic look at what we need and want out of our farming systems. And so I really like this graph from this meta review of organic versus conventional systems, showing us that organic is giving us a far better balance of those outcomes that we might be aiming for: production, environment, economy, and well-being. So this is really not pie in the sky. Wouldn't it be nice if we could reduce use of pesticides? This is an imperative. Expert consensus concludes that we need to rapidly reduce our use of pesticides and shift towards agroecological systems in order to address this suite of crises we're facing: world hunger, biodiversity, and climate change. Essentially, this pesticide-intensive system is sawing off the branch that we're sitting on. It's undermining the soil, the water, the climate, the biodiversity that we need to continue to produce food. So investing our resources in moving towards ecological production will ensure that we can feed all generations now and into the future. These are a few websites with links to those studies that I mentioned, and please feel free to reach out if you have any questions. I'll leave that up for just a moment here, and then turn it back to Sapna.
Thank you, Kendra. And I will just turn it over to David now.
Okay. How does that look?
Looks great.
Okay, good. So I want to thank Sapna and the UC Center for Climate Health and Equity for organizing this webinar, and Kendra for giving such a great talk about pesticides. So I don't have to talk about pesticides. They're a big problem, but the question I'm asking today is diet the key to resolving the climate health equity crisis? And to understand this, we first have to put climate health equity crisis in the context of the larger crisis, which is the Anthropocene crisis, which is the unsustainable pressure on the earth, health, and society, threatening a planetary and public health catastrophe. Climate change is the greatest threat among many, and you can see here on this graph, this recent IPCC graph, the super exponential increase in surface temperature in the last century or so. And the major cause of this unsustainable pressure is the exponential increase in consumption by humans, especially superfluous consumption. So what do I mean by superfluous consumption? Superfluous consumption is consumption that has diminishing returns of well-being based on research with multiple indicators. And it also increases the negative impact, for example, on climate health, the environment, and equity. And you can see here in this example, we have the United States on one end of the one extreme, and we have Haiti on the other end. Populations in the United States are superfluous consuming populations. The much of the consumption of populations like ours does not return, does not have returns in terms of well-being. On the other hand, countries like Haiti just don't have enough consumption. And so this is an example of the kind of injustice that occurs in our food system. So what is the role of the food system? I want to talk about the climate health food nexus as the core of the Anthropocene crisis. And the food system has major negative impacts on climate health and the environment. And the food system affects large parts of the of our total impact because of superfluous consumption. For example, about 10% of the energy and 28% of the protein in global diets is in excess of nutritional requirements. And about a third of all our food is either lost or wasted between production and consumption. And animal source foods are very inefficient, as we will see. The global food system, first of all, affects climate change. The global food system accounts for 1/3 of total anthropogenic greenhouse gas emissions and much of the methane, which is a very powerful greenhouse gas, mostly in agriculture from ruminant animals. At the same time, climate change affects agriculture, increasing heat, droughts, floods, etc., reduce total yield and production. And this, of course, has effects on human disease in terms of increasing food scarcity, undernutrition, malnutrition. And human disease also affects the global food system because people who are poorly nourished, malnourished, have reduced labor productivity. And climate change also affects human disease directly, as I'm sure we're all aware, given the recent flooding and high heat events. And as well, human disease also affects climate change, which is what I want to talk about next. And it drives climate change because human disease, especially non-communicable diseases that are diet-related, and most disease in the world now is related to our diets. And this incurs huge healthcare costs, and all these costs have impact on our climate and other aspects of our environment. So I want to share a modeling study that we did a few years ago where we took the SAD diet, that's a good acronym for the standard American diet, which is pretty unhealthy. And we made a healthy diet by reducing red and processed meat and increasing more healthy plant-based foods. And we found annual reductions of about 29 to 45% in the relative risk for 3 major non-communicable diet-related diseases, and a reduction of 93 billion in healthcare costs. And these reduction in costs resulted in a reduction of 83 kilograms per capita of greenhouse gas emissions. So this shows that more plant-based diets can improve health and reduce healthcare costs and their environmental impacts. But these results are also very conservative because The US healthcare bill is over $3 trillion per year, and diet-related diseases are a large portion of this. So we didn't have the adequate data to do a complete analysis. The next thing I want to talk about in some detail is how the food system also drives disease by harming planetary health. And planetary health is absolutely essential for human health, because humans can't exist, well, can't thrive on a planet which the ecosystems are not healthy as well. Yet our food system does vast harm to planetary health, and animal source foods do the most harm. I want to show you some data to illustrate this. First of all, animal source foods drive land use change. Animal agriculture uses 77% of the ag land, but it's so inefficient that it supplies only 18% of the energy and 37% of the protein in our global diet. At the same time, land use also drives increasing greenhouse gas emissions by deforestation, etc., decreasing carbon fixation due to constant tillage, and decreasing rain and moisture, soil moisture, increasing zoonoses, and increasing biodiversity loss. And this biodiversity loss is especially, I was startled when I saw these data. 85% of wild mammal biomass has been lost, and the livestock biomass is now 14 times that of wild mammals and 1.7 times that of humans, with 30 billion terrestrial vertebrate livestock, 4 times the number of humans. Animal source foods also drive fresh water use. Here's an example on the left from the Colorado River Basin, which supplies much of the fresh water for the southwestern United States, and livestock accounts for 56% of all those with fresh water withdrawals from the basin, with only 13% for food crops. Agriculture globally uses more than 80% of freshwater withdrawals, and plant foods use much less fresh water per unit mass. Protein in kilocalorie, for example, per gram of protein, beef uses 112 versus 16 liters of fresh water by pulses. Therefore, animal source foods exacerbate water shortage, pollution, and increase drinking water scarcity, and therefore inequity. Animal source foods also drive nitrogen and phosphorus pollution. These two elements are critical for food production and applied to cropland and fertilizers, but their leakage to the environment is a major contributor to air and water pollution, including eutrophication. For example, in the US, animal source foods contribute 70 and 80% of phosphorus leaked by the food, nitrogen and phosphorus leaked by the food system, with beef alone accounting for 40 and 50% of these two elements. And finally, animal source foods drive air pollution. In the US, 80% of the air quality related deaths are from animal source foods, and only 20% from plant source foods. That which means that a plant-based diet would reduce mortality by about 83%. So we've seen that the global food system is a major problem for climate change, human health, and planetary health. So how can we reorient this, this system? Why don't I give you a couple of examples from some research that I've been involved in. And the first is default veg experiments. We did 3 experiments at UCLA, 2 at UCLA, and 1 at Harvard, where for these events, we compared the default of a meat-based meal to the default of a plant-based meal for 2 components of the participants. And we found that increased plant-based defaults increased the meal choices of plant-based from 18 to 65%, and plant-based default also reduced the impact significantly, as you can see here, for greenhouse gas emissions and 3 other environmental impacts, from the meat meal default to the plant meal default. But at the same time, the events which were organized with plant-based defaults still far exceeded the planetary boundary here, indicated with this horizontal line. Another project I was involved in, working with students and dining staff at UC Santa Barbara, was switching from egg-based to plant-based mayo in UCSB dining. And we found as a result of this, there was a reduction in animals suffering in the egg industry, as well as reduced greenhouse gas emissions and reduced environmental impacts. And using our parameters, we extrapolated this switch to substituting tofu for eggs in 50% of first-year UC student breakfast. And of course, as you would expect, the impacts are much greater. Yet at the same time, changes like these do make small reductions in superfluous, that is, animal source food consumption. Yet even these changes are not adopted widely, including across the University of California. And the UC and most universities and other institutions do not even include food in their greenhouse gas emissions accounting and mitigation policies, not to mention other environmental impact policies. So my question is, how can we scale up these kind of changes? Well, here's one example from a modeling study done a few years ago, where researchers created counterfactual scenarios where all foods were taxed based on their greenhouse gas emissions using their social cost of carbon. And as you can see here, this tax would increase the price of food, especially animal foods, which are most greenhouse gas intensive. And it would also decrease consumption of these foods, and resulted in about 1 gigaton of total global greenhouse gas emissions per year. But 1 gigaton is far from where we need to get, because the current food system currently emits about 15 to 20 gigatons a year. And the planetary boundary for the food system is around 5 gigatons a year, which means we need to eliminate 10 to 15 gigatons a year from the food system. So with all this evidence, why don't we make the big changes appropriate to the Anthropocene crisis? Well, I think that the main reason is cognitive dissonance. The cognitive dissonance in this case is the conflict between the comforting lie of superfluous consumption, which is familiar, it's easy, it's habitual, it's promoted by the food industry as well as governments often. And this is in contrast, conflicts with the unpleasant truth from scientific research that superfluous consumption does not deliver well-being or a livable planet. So what are the options for resolving this dissonance? Oh, one is just to cling to the comforting lie and ignore it. The continuous superfluous consumption can be supported by market-based green growth, is the assumption that's made. And that in turn is based on the key assumption that economic growth can be decoupled from environmental impact simply by increasing the efficiency, so that we can continue superfluous consumption. But this assumption of green growth is not scientifically supported. And absolute impact and inequity would increase. Accepting this lie is facilitated by the human capacity for hedonic reward, materialism, and for discounting the future. But it won't adequately address the Anthropocene crisis. Yet, is it accepted by many public good institutions, including universities and governments? So, fortunately, we have an alternative, which is to accept the so-called unpleasant truth, which actually is not so unpleasant at all. And this is the scientific evidence that we need to replace superfluous consumption with sufficient consumption. And this, in contrast, builds on the human capacity for eudaimonic reward, for empathy, compassion, and for valuing the future. And this is needed in order to avoid the threatening planetary and public health catastrophe. And we can see here, as you remember the graphic that I showed at the beginning of the presentation, and the contrast between these extremes of industrial countries, many richer industrial countries, which have high levels of superfluous consumption with low returns to well-being, and many other populations in the world that have inadequate, insufficient consumption, and so have very low qualities of life, very low well-being. However, there's another option, and that is countries like Costa Rica, which have much lower consumption than the United States and much lower impact as a result. But also, actually, in the case of Costa Rica and the United States, Costa Rica has higher life expectancy and happiness, and higher well-being. So reducing superfluous consumption, for example, increasing plant-based foods, will increase equity by freeing up resources for populations with insufficient consumption. And the result can be that sufficient consumption can increase well-being for all while decreasing net environmental impact. So at the beginning, I posed this question: is diet key to resolving the climate health equity crisis? You won't be surprised that my answer is yes. To make our campuses, our communities, and the world more livable, healthier, and equitable, we need to accept the unpleasant truth and institutionalize sufficient consumption and more plant-based diets. This will be difficult, but there are no alternative ways to a livable future on our planet. Thank you.
Thank you, David. We have a few questions coming in, and before we go through some of the questions, and I see that Kendra, you're interested in answering some of them. I want to thank you and Kendra for sharing your perspectives today. And it's interesting, like planetary health and soil health are like the canary in the coal mine. So clearly we should be paying more attention to them when we're thinking about our own health. So I'm going to go through some of the questions in the chat, and there are a few questions and comments related to tofu and soy. And Kendra, maybe I'll turn it over to you. So I'm going to summarize some of these questions. If we substitute tofu for eggs, wouldn't we increase our consumption of soy? If so, this could cause its own problem, as the previous presentation showed that 94% of soy is Roundup ready. So how do we balance the two? And then there was another comment about how there are many soy allergies, and a lot of soy sources are from genetically modified sources. So Kendra, would you want to comment on that first?
Yeah, I think it matters, what lens are we looking through? What are we asking about? If it's related to climate costs, then soy is going to have a lower impact than eggs or other animal products. But yes, if you are just buying soy and not seeking out organic soy products, then it is highly likely genetically modified. It's grown with Roundup, it's contributing to the pesticide crisis, biodiversity loss, et cetera. So the best alternative that we have right now is the organic certification that is set by federal law. We know what we're getting when we are buying organic, and glyphosate and so many other pesticides are prohibited. That we do a lot of work, that creates a huge problem because not everybody can afford organic food. And so we really need to flip the understanding of organic as a niche, if you can buy it, that's great for you, to organic as the human right, that nobody should have to have enough money in their pocket when they walk into the grocery store to buy food that is not contaminated with residues of toxic pesticides, and that is not contributing to climate and biodiversity crises and to public health crises all along that supply chain, farm workers and farmers. So we at Friends of the Earth and many of our allies are trying to do that work to this glacial change of changing policy so that our food system supports organic and other ecological farmers rather than propping up this incredibly resource and pesticide intensive food system, which is currently the state of things. We're spending billions of taxpayer dollars to prop up this highly problematic system. So we can look to the EU for some leadership. They are negotiating goals to decrease pesticide use by 50% and to increase organic acreage to 25% of all acreage. Those type of very bold, far-reaching policy goals are what we need in order to truly shift the system to make organic and other truly sustainable foods affordable for all people, and to make sure that farmers are supported and that they're not the ones being squeezed and requested to do everything without being financially supported in that transition.
David, did you have anything you wanted to add?
Yeah, I think Kendra's point is the key one, which is everything's interconnected, which is the point I tried to make as well, that you can't just focus on climate. You can't just focus on pesticides. You can't just focus on water or air pollution, because these things are intimately interrelated and they're part of a sick system. And so we have to be thinking about systemically. And I think, our current world economic system based on neoliberal economics, although that's being challenged with these populist regimes, that economic system is what's driving this. And even when there's alternatives, people still try to integrate the alternatives into that dead-end economic system. In other words, how much more profit can I make by being more sustainable? Well, ultimately we have to dial back and realize that we can't continue to have increasing profits, increasing corporate growth, and I think that is the kind of the fundamental thing that we need to be thinking about. And my hope is that these climate catastrophes that we're seeing and these other kind of major social impacts will wake up people to the fact that we need to change the way we fundamentally think about human well-being and economics on the planet.
Well, thank you. So speaking of alternatives, we received a few questions in the chat about meat made in labs or the emerging market for lab cultivated proteins. Yeah. Do you have any thoughts you'd like to share about those? Are they part of the solution to climate, health, and so on?
Well, I guess to some extent they could be. I haven't done a lot of research on that, but the question is, where are the data? We need to see the data on what the environmental impact of these alternatives are. And again, most entrepreneurial ventures these new products are funded by venture capitalists, and venture capitalists have one thing in mind, and that's double-digit returns on investment. So when you look at what's happening with these things, they tend to focus on one key benefit and ignore all the potential downsides. For example, Impossible Foods in the Bay Area, which has become very popular because of their genetically engineered plant-based meat alternatives. Speaking of soy, several years ago, their market was expanding so rapidly that they decided to dial back on their previous commitment to only sourcing organic soybeans. And they said, well, the market's expanding. We can't deal with this. There's not enough organic soy. So they started using conventional soy, which, as Kendra's explained, is herbicide intensive. So I think we really have to look at the alternatives and understand what the motivation of the people and the companies that are promoting these are, and ask for the data to support claims, and ask for the total impact of these products, and not just one or two.
Thank you, David. Kendra, there's a question for you about, are there any studies you can point to about the presence of pesticides and other harmful chemicals on organically grown crops, which are impacted by pesticide drift and fed by the same water tables and so on?
Yes. So pesticide use is so ubiquitous that we find pesticides in nearly every stream across the United States. We find glyphosate and other pesticides in the rain across the Midwest. And so really there's no way, if you have an organic farm and it's raining, you're stuck in this toxic system. And so we do find pesticide residues on organic food. We find them, however, at much lower levels. And the fact that we've got a dozen studies comparing pesticide body burden on conventional versus organic diets, we know that we're getting lower exposure from those organic foods. Also, testing of residues shows us that as well. You can look at the dietary risk index created by Charles Benbrook at Hygiea Analytics, and I posted it in the Q&A, and hopefully the answers I'm writing there are going to everybody. Another resource would be a website called What's on My Food that is hosted by Pesticide Action Network that takes the USDA data and makes it very searchable by food crop or by pesticide. And some of those also include the data on what residues were found on organic, so like conventional apples versus organic apples. So those are two places that you can look to compare data sources. But yes, we need some very serious policy change in order to detoxify the entire system. And just another note on why do we not make the big changes that we need to. There's great data, and in recent years, more information has emerged on the incredible power of the pesticide industry over the EPA. And I don't know if I can, I'll try to post it in the Q&A. There's a link to an Intercept article that really highlights the way in which our agencies have been captured by very powerful corporations and are serving their interests above and beyond their mandate to protect our health and the environment.
Could I just say something? That is, the corporation's mandate is to make money. That's why there's this conflict, because that is their primary obligation to their shareholders as public corporations, and that's part, or to venture capitalists if they're private. So that's a key problem. I'd just like to comment. Another question is, how can we? Someone wrote a very good comment or question, and that is, even if we accept unpleasant truths, that doesn't mean we're going to actually change in response to that information. And how can we actually promote that kind of change? And one way that I think, as I mentioned, I think empathy is a key here, and that's empathy for future generations, for example, empathy for other people in the planet, not just our own families, our own community, our own country, but also empathy for all the other living things on the planet. Our industrial agriculture system, as I mentioned, 30 billion animals in any one time, and the conditions that most of these animals are kept in are just horrendous. And we increasingly, the more we read, most animals are capable of emotions and feeling pain, all the way from insects, fish, all the way up, of course, to humans. And so I think nurturing this kind of empathy for other living beings and other people and other places and situations is one way that we can, I think, be motivated to make the changes we need, because we actually also are all in this together, as we only have one planet, and unless we make these changes, we also will ultimately suffer.
Thank you for that. And that they're related to that. There are several of, I would say, solutions-oriented questions in the chat, and we only have a limited amount of time left. Clearly, these are big global systems issues that involve a variety of players, corporations, and so on. So maybe we can think about solutions in the last few minutes. What are strategies that universities can pursue if they want to serve more plant-based diets? What are incentives for individuals to support them in making healthier choices? What are policy changes you would recommend? That's a huge question, but if you have any last minute words that you would like to share around solutions, I think folks would appreciate that.
I could say something quickly about universities, and that is, I'm familiar mostly with the University of California, but I think this is true from other universities. I know that the food system on campus is considered a revenue generating system, so that even dining directors who are motivated to make changes for the planet, for the health, for equity, are constrained by the financial interests of the campus administration to have revenue coming in from the food system. And I think that's a conflict of interest. And I think one of the things we could do is advocate for campuses to move their food system administration into the health and sustainability departments and give them the power to make the changes they need to actually improve campus food systems, increase plant-based foods.
Yeah, I mean, the policy question is enormous. And I think that, you know, if I could achieve one thing, if we could set up firewalls that constrain the influence of corporations over our policymakers, over our federal agencies, that would be enormous, because that will shifts away from serving corporate interests towards serving the public good. And so I think that would be the overarching goal that we need. And I think also, I sometimes wish like every nonprofit would spend 5 years working to pass a truly livable minimum wage, because that would be a completely different world. And the question of affordability of organic would not be an issue if people were truly making enough money to support themselves and their families.
Of course, to do that, we would need to start taxing the super rich and the rich to be able to give a livable income. So it really means income distribution for more equity in all systems on the planet, including our food system.
Well, thank you, David and Kendra. Any 10-second or 1 or 2 line sentences for folks' immediate action they can take, in their day-to-day lives that could have an impact long-term if we all worked on it collectively?
Cook more delicious plant-based food and share it with friends.
Yeah, and I'll point folks to 2 resources. One is organicforall.org, which does have a little 2-minute video that you can share with friends and family on the results of that organic diet intervention. And then Friends of the Earth has a program on climate-friendly food. And so if you just Google Friends of the Earth climate-friendly food, there's a whole wealth of resources there.
Well, thank you. Thank you for those tips. Thank you for those thoughts, from the systems level down to the individual level. And thank you, David and Kendra, for spending so much time with us today and sharing your insights. Thank you to the attendees as well. This webinar was recorded, and the Center for Climate Health and Equity will be sharing a link in the near future, and we look forward to sharing that with you. Thank you all for attending, and we hope you enjoy the rest of your day.